this is going to be a little bit different than we had planned. And actually, there was a little bit of a scheduling issue, and we're going to present together. So I'm going to tell you about organ reproductive medicine for a few minutes, and then John Shelley's going to tell you about Northwest Surrogacy Center so that you can sort of see both sides of it. Thank you guys for coming. My name's Brandon Bankowski. I'm one of the partners at ORM, and I've been bounced around for training a little bit. I did my undergraduate training in biomechanical engineering at Cornell, and then I went to Georgetown for medical school, and then spent 7 years in Baltimore at the Johns Hopkins Hospital to do all of that training, and now I've been at ORM for about 10 years. ORM is a fairly big operation. I just learned that we're up to about 85 people altogether, because what we do is very complex in terms of the processes, and to do it at a very, very high level takes a lot of very qualified staff. And so for the donor egg surrogacy part of it, which is actually the most complex of the treatments that we do, there are about 25 people specifically that are involved in supporting you. And again, the goal, as I have mentioned before, our goal is really to make this, number one, the highest quality care that we can provide, but also the highest quality experience for you, because hopefully you're going to go through this one time, have your family from that one time, and we want it to be a very positive thing. IVF is definitely our focus, and not only does that quality staff contribute to that, but our laboratory is really a key part of it. Our laboratory is essentially a clean room, and we partnered with the clean room engineers from the local Intel headquarters, and they helped to build this in 1999. And it has allowed us to grow embryos in a very, very good environment for a long time, and that's why our success rates have been so high. As I mentioned before, some of you may have heard, there's a national database called SART. You can go on SART.com and look at all the clinics. Unfortunately, SART doesn't make it very easy for you. They don't specifically present donor egg with surrogacy. Do you transfer one embryo? What are the success rates? If you transfer two, what are the success rates? Even though they have all that data, because we submit it to them, they've chosen to present it in a certain way. So when you're evaluating programs, you're going to have to do a little bit more homework, but you should look at the IVF data for this year, for going back 5 years, and check out everything. Because again, a program with a really good laboratory that's very, very good at putting sperm and eggs together in the way to make the healthiest babies should have a track record of success. And so the quality of the care and the success rates that we provide you is really, really important. But it's also really important that you connect with the providers, with the agency, with the donor if you choose to do that, that you feel very comfortable and are very at peace with how you do this, because most of you probably have never done this before. And to go with programs that do it a lot, when I asked my chief coordinator about what the numbers were, and right now we just had a bunch of graduations, meaning you get pregnant, you go off to your OB. So we lost 15 patients, but right now I have 105 surrogates that are in cycle now. So they're in the medicine or early pregnant. And we do most of our business with Northwest Surrogacy, so about 80 of those or so overlap. But to have that much experience and know what the problems are, what they're going to be, and then create a system where those problems never even happen for you, because we know is really important. So connecting with you, explaining in the way that we think is simplest for you how we do things, why we do them, what's going to come next, what can't we predict, what can't we control. If there's a problem, we're going to jump in, say this is what happened, this is how we're going to fix it, and that's really key. And we want to work with partners who do that as well. One of the elements of success also comes from genetics. The genetics world has exploded in the last 3 to 4 years mainly, and now over half of all of our patients that we treat, and we're doing about 1,400 IVF cycles a year, but over half of them are doing something called CCS. This stands for comprehensive chromosome screening. Basically, it involves that you grow the embryo. Embryo kind of looks like this, a big beach ball with a group of cells on the inside that makes the baby. And when we grow them to day 5, we can biopsy several of the cells on the outside, freeze that embryo, and then attach genetic probes to tell you that all the DNA is normal. We used to, about 5 years ago, attach 10 genetic probes, and now we're attaching about 500,000. So all of the chromosomes are covered. A wealth of data over each embryo. Is it normal? Is it not? We're looking for 46XX and 46XY. Those are the only right answers. Normal, healthy embryos. And what's really surprising about this, which actually gives you a sense of how complicated human reproduction is, many times, especially if the couples have met with a surrogacy agency before, they just think, well, it's just going to happen, right? And then you kind of overlook the medicine. I mean, to have this work it's miraculous, really. But even if you take a young woman who's 22 years old and you choose her because she's passed all the fertility tests, and we take that egg from a woman in the peak of her fertility and put it together with a healthy sperm and make an embryo, 1 out of 4 of those are chromosomally abnormal. They will not make a healthy baby. Most of those don't implant, or if they do, they miscarry. 1 out of 4. That's as good as it gets in humans. So it's complicated. That's a big number. And that's why the majority of our patients are interested in this CCS. Our program has been very fortunate to help a lot of people and have very high success rates in doing it, which is why this is so enjoyable to me, because I get to make almost everybody happy the first time. Most of our patients actually, they'll split. So one of the partners will take their sperm, the other their sperm, and they'll divide the eggs in half. And so when we choose an egg donor, we want to make sure she's got a lot of eggs. And then you'll grow those down to the blastocyst stage, that day 5 stage. And if you test them or not, we often take 1 from each person and transfer them together. That's the most common thing we do. The average number of embryos we transfer is about 1.7. So that tells you that about 1/3 of patients are doing single embryo transfers. And that number is increasing over time, but it's up to you, 1 or 2 embryos. If you transfer 1, the chance of having a baby is 70% in our program per transfer. So live birth per transfer, put back 1 embryo, 70% of those have babies. And about 1 or 2% have twins because the embryo can split, make identical twins. Most commonly, we're transferring 2. And over the last 100 cases that we've done that over the last couple of years, the live birth rate has been 90%. And of those, 70% are twins, unless you do CCS, in which we're starting to see that the CCS results in more twins. It's about 80% twins. Now, as I said before, and as you all know, twins, although they're a goal for many people, you have to really think about that and really be prepared, and the surrogate has to be prepared because there are more complications that come from the transfer of 2. Most twins are quite healthy, but what happens is because the uterus itself gets overdistended, physically what happens is they go into labor earlier. And so instead of being born around 40 weeks, the average twins are born around 36 weeks. Okay? So the whole curve is shifted a little bit earlier. Now, most twins at 36 weeks are fine. My babies were 36 and 5, my twins, when they were born, and they were over 7 pounds each. So my poor wife, you know, but they were fine. They did great. But if you follow those curves down, if you're looking at, well, what babies are born at 30 weeks, you're going to see that more commonly in twins than 1, and the earlier they're born, the more the chance of complications. And that's something that can't be predicted. Again, most twins do great. Doesn't mean that they're going to have problems, but that's what we always worry about. So that's kind of the trade-off. We have, it's so confusing is who's helping you and everything. So to get started, and then I want to let John talk, and then we'll handle whatever questions you have. But to get started, we usually Skype. Of course, many people come through Portland, and that's easy to meet in person or to have a one-on-one here. But we usually Skype, and then our lead coordinator goes through the details. What do we do step by step by step? Of course, people, the intended parents have to come at least twice. Once because we need the sperm to use it, and then once because they need to pick up the babies. And most people come one time in between there as well. But there's a team that takes care of you in our program. It's your main coordinator. There's a donor matching specialist named Corby. There's a genetic counselor that you talk to. There is a financial counselor that you talk to. So there's a handful of about 5 people that help you step by step through the process. And as most of you probably know, we follow you through the first trimester. And once everything is off and running with the pregnancy and everything looks healthy, then you transition over to the obstetrician, the pregnancy doctor, and that's usually when the surrogacy agency comes back in to help you through to the birth and the establishment of parentage. So that's just a quick introduction of our practice. Introduce John Shelley, and then we'll talk about whatever questions you have. But thank you for your time.
So Sandy Hodson and I are the co-directors of Northwest Surrogacy Center. It's a program that started in Oregon. About 20 years ago. Previous to that, both Sandy and I had been working mostly on adoptions as lawyers, and over time there became more and more interested in assisted reproductive technology work. And as I mentioned, 20 years ago we started Northwest Surrogacy Center because we thought that we really needed to provide a full range of services to clients as opposed to just the legal portion of it. We're located in Portland, Oregon. I'm going to guess 2 miles from Oregon Reproductive Medicine. And we also have an office in San Francisco as well. We love the two places, first just simply because they're comfortable, not only for us, but for all of our clients who are living there or who are visiting. The weather's good in San Francisco, not always so good in Portland, but it's comfortable, it's clean, it's safe, and people consistently enjoy coming to Portland, coming to San Francisco to be a part of Northwest Surrogacy Center. One of the questions that came up in the meeting today had to do with so how do you start making sense and sort all of this out? And there's a couple of basic things that I want to suggest that you might look at. When you look at the numbers from Oregon Reproductive Medicine, the fact is that they're very impressive. The reason we love the numbers from Oregon Reproductive Medicine is it means that it gets they get our clients pregnant. And with such a high degree of consistency that, as Dr. Bankowski says, he gets to live with success with his clients in almost all circumstances. And that's especially for your group. And when I talk about your group, I mean one that's using gestational surrogacy and a donor egg. And as you mentioned, the numbers are high. It's a big deal to us as well. If you look at men having babies, they have a survey, and we're listed, the agencies are listed in that survey. And we're number one of all those that have been reviewed. And these are reviewed by clients of ours who have gone through the program and then contributed information to men having babies. And we've been number one alone for at least a year at this point. And the reason that they do the survey and provide that information is that it does help you try to work through all of the combating information that exists out there and get information from clients, people who have already gone through this process. And I want to suggest that that's another way to do it. Now, in looking at programs, I want to suggest you look at a couple of things. One of them is whether they're going to get you pregnant. We've talked about that. Second thing that I would really want to suggest that you look at is the work that goes in to the surrogate, to begin with, so that what we do is to spend most of our time up front doing the entire screening process. And so that by the time that you meet the surrogate for the first time, you're going to be in a situation where she's gone through a background check, she's met with a psychologist, she's met with a social worker, she's had her medical records reviewed by Dr. Bankowski or one of the other physicians at the clinic. And what that does is it significantly increases the likelihood that the first person you meet with is going to be successful with you with respect to her background and her medication. It's the best thing that we can do. It's the most that we can do to choose a surrogate and introduce you to that surrogate that you're likely to be successful with. We are a full service agency, which means that we take you from the very beginning of the process up to the point where you're traveling home with your baby. And the fact is, I wish I didn't have to say this, but the fact is that this is really complex stuff. And not everything is going to go smoothly for everybody. It just isn't. And so one of the things that we're very proud of is the fact that we stick through it from the very beginning to the very end. And that means that after you get pregnant, we're still working on it. We're still working on it for 4 or 5 months after, or for, what would be they're with you for the first 10 weeks, 12 weeks, something like that. Throughout that process, we're working with them, and we're working with them all up to the time that they actually have their baby. We help with communication concerns. We help with a whole host of issues that I see we don't have much time to talk about right now. So we'd love to work with you. Portland is a great place to be. San Francisco is a great place to work. And we'd love to be able to share more about our program with you.
One of the things I did want to mention on the tails of what you said is that we love working with them because they have the shortest match time that we know of. They're about 3 to 4 months now. So patients start with us, we get the sperm samples, they pick the donor, we put the donor through the process. Let's say we started right away in November. The donor goes through December, we get the eggs, we create embryos in January. That's 3 or 4 months. All of a sudden all of a sudden you're matching with your surrogate right around that time. We update the testing and go right into the transfer. So the process goes really quickly. When you desynchronize the donors and the surrogates, you can move forward on both fronts at the same time. And this all contributes to you getting to your goal as quickly as you can. So, that's really nice to have such a short match time. A lot of the other programs, the match times are up to a year. And you just have to ask questions and find out kind of what people are doing. But yeah, it's a good partnership.
Thank you.
Questions?
And you can desynchronize because you'd be freezing the embryo.
That's right. That's right. Yep, exactly. It doesn't. The only way in which well, let me put it this way. There is no difference in the implantation rates in our program between an embryo that's been vitrified and one that has not. Okay. However, they do not all survive the freeze and thaw process. If you look at our year-to-date survival rates, 97% of our embryos have survived. So it is possible that you could lose an embryo by freezing it, but it's very, very rare overall. It's even rarer in the donor egg population because the eggs are such good quality. The embryos are such good quality. What it helps so much, though, with the surrogates love it, the donors love it, it makes everything go faster. And because most of our patients are doing CCS now, the embryos have to be frozen anyway for CCS. And that's kind of where the field is going. Yeah. Yes?
I have a question. This morning, somebody mentioned about how surrogate healthcare insurance is so different state by state. John, how's it looking for Oregon, especially as the year changes into the new year?
You bet. Oregon has consistently been one of the better states to work in as far as that's concerned. And so that we've consistently been able to see insurance companies cover both the cost of the pregnancy itself, meaning health insurance for the surrogate, as well as insurance for the babies, which has been a big deal. It's kind of a moving target, though. Everything changed on January 1st of the year. It changed because of the Affordable Care Act. Obamacare became effective, and then it's going to change again on January 1st of 2015. We're getting all the policies out in about on November 15th, a couple weeks from right now. And as soon as we get those policies, we'll be looking to see what kind of provisions they have, if any, concerning surrogacy. What I can tell you, though, is that out of all of the places that I've known, it has more consistently covered both the baby and the surrogacy itself, meaning the pregnancy itself, more so than any other place that we've been. And so we actually kind of have a different vision and ethic in Oregon. It is separate between the states. We do have support of our insurance commissioner in Oregon, so we're real hopeful that will continue.